Hello, everyone, and welcome to this session. What can your council do to support inclusion and belonging? So I'm Sam Peck. I use she, they pronouns, and I'm the CEO and Executive Director of Family Councils of Ontario. I'm joining you today from what's colonially known as the City of Hamilton, and that's the traditional territories of the Erie, Neutral, Huron-Wendat, Haudenosaunee, and Mississaugas. It's land covered by the Dish with One Spoon Wampum Belt Covenant, and that was an agreement between the Haudenosaunee and the Anishinaabeg to share and care for the resources around the Great Lake. Eating from one dish with one spoon is a way to share resources and ensuring no one is getting more than they need and that there's enough for everyone. The land is also covered by the Between the Lakes Purchase of 1792 between the Crown and the Mississaugas of the Credit First Nation. Land acknowledgements are an essential first step in moving forward on a path to reconciliation. And land acknowledgements are influenced by the Truth and Reconciliation Commission's 94 calls to action in acknowledging the first occupants of this land. They also help to educate the broader public on the significance of the relationship between Indigenous peoples and their territories. For me, it makes me pause and reflect about the land I live on. I start with, how am I supporting the environment, the literal land on which we grow trees for oxygen, which we get our food from, that supports our drinking water. And so I have started a native garden to support good use of the land and local species like monarch butterflies. To me, that's the connection with the natural world and how to support that. So a little bit about me, or more about me before we get started. I'm a gender fluid, white, female-bodied person. I have a post-secondary education. English is my first language. I'm Canadian born, descendant of settlers from many generations ago, and I have an underlying health condition that creates dynamic disability. Looking at me, you can't tell all of those things. You can tell some of them, but not all. And I start this session this way to emphasize that there's a lot that we often don't know about each other, where we're coming from, and what it would look like to us as individuals to be included and to feel that we belong. Because we all have what's called an invisible backpack. And this is a term from Peggy McIntosh's 1989 essay regarding white privilege. It's a framework that defines an invisible backpack as unearned, unacknowledged assets, power, and advantages that a person unconsciously carries with them due to their race, gender, class, or physical abilities. So I have many of those privileges. It's also been taken to mean each person in the world is carrying struggles, challenges, fears, trauma, abuse, losses, and other weights and burdens that we are not aware of and cannot see. But my hope is that by listening to this session, reflecting on what it means to your council and how to be more inclusive and create spaces of belonging, we can unpack some of that backpack. We can share what's in it. We can use the tools, the resources, the privilege that we bring to support long-term care homes so that everyone has a vibrant experience. And that as a council, you creating spaces where people really feel that they belong and where they want to spend their time. So we're going to cover what are diversity and inclusion, make sure we have a baseline. We're going to talk about why it's important to understand this and strive to be inclusive, maybe based on some of the research that we've done. We're going to start a conversation about what are you currently doing to help create a welcoming and inclusive environment? And next steps, what do you do with what you've learned, what you've heard today, that you can take back and support diversity and inclusion? And this work relates directly to our intended impact statement as an organization. This intended impact statement was created following a year-long project where we worked with an external organization called Innoweave and a coach to really flesh out our intended impact statement and start developing ways to measure that so that we know where we're succeeding and where we can improve. It's at the heart of what we do. And our statement is that we will partner with family caregivers and long-term care home champions in fostering sustainable and effective family councils. The goal is to have councils, effective councils in 75% of long-term care homes in Ontario by 2030. And so I'll let you read that statement. But what I'm going to call out specifically is that our approach is to help councils be stronger, more inclusive, and promote a sense of belonging. Because we really do believe that family councils have an incredible role to play in shaping the culture and the quality of a long-term care home. And when you can ensure that your table is big enough and that everyone feels that they can roll up, take a seat, stand if they need to nearby, that your work will improve. If you have more questions about this intended impact statement or what we call our Innoweave project, where we're working to bring this intended impact statement to life, please follow up with our team. We know that some parts of this discussion may feel challenging or uncomfortable. That's okay. But we hope that these honest conversations will lead to meaningful learning and growth. Sometimes we have to be a little outside of our comfort zone in order to make that comfort zone bigger. We're going to approach the discussion with care, openness, and respect. That's for ourselves and others. And given this as a virtual space, I'm hoping that you'll find that it can be easy if you need to take a moment to reflect on your thoughts and feelings, step away if needed. But we want you to keep the shared goal in mind. We want to build strong, welcoming, and inclusive long-term care communities. Ontario is a wonderfully diverse province. We have, I think, Toronto in Ontario may be one of the most diverse cities in the world. The population of Ontario is growing. We have people from all walks of life and experiences, and that can create really inclusive long-term care homes when those folks are included. We want you to stay present, listen openly, and move at a pace that supports you to thoughtfully participate. Our ground rules that we use for sessions like this is we want to help create a psychologically safe setting for the discussion. We want to assume positive intent. We acknowledge impact, but we can try to probe what others' intentions may be and not assume that people are trying to do harm. If harm is done, we call it out, call people in, but try to assume the best until we know otherwise. Like in a family council, confidentiality is super important. Stories stay, learnings go. So we're hoping you take the learnings with you, but if any personal stories are shared, we indicate that and that those are for this space only. Speak from personal experience to avoid making generalizations by using I statements. Again, lean into the discomfort. If it's uncomfortable, hopefully it's a constructive conversation and you can lean in. Listen actively to understand, not to respond. But at the same time, you have to have a zero, and we have a zero tolerance policy where derogatory, discriminatory, or harassing language is not permitted. So as your council, feel free to adopt or adapt these ground rules, add your own, whatever works best for you. But we really encourage you to think about the intent, separate from impact, using I statements, and being clear about what language and behavior is not acceptable. Because by providing those ground rules, you know, like a code of conduct, what behavior you're looking for and what you won't accept. And that creates some safety within the group. So I want to start with just a little quick discussion in the chat. So feel free to go there. And I want you to chime in about what does diversity mean to you? So feel free to head on over to the chat. I will take a look as well, just see if there's anything anyone is suggesting. So what comes to mind? Words, phrases, anything where it's like, when I say diversity, what does that mean to you? So I'm seeing in the chat, acknowledging and accepting differences. Yeah, knowing that people are different. We're not all the same. We have wonderful diversity. And so acknowledging and accepting that. Okay, see some others typing away. Give them a moment. Having a family council that represents the diversity our home has. Love it. Because ideally, if you have a home that serves many or particular populations, perhaps you're a very multicultural home in Toronto, perhaps a home up north that has a large Indigenous population, or maybe that has Francophone or Finnish speakers, that your council will reflect that. Accepting differences in culture, race, age, beliefs, abilities, and life experiences. Absolutely. And honoring lived stories. What's in our backpacks? What's in our invisible backpacks? Do people feel comfortable sharing that their full personhood matters to the council? Love it. Thank you. Now, with that, so what does inclusion mean to you? We have diversity. What would it mean to be inclusive? So again, head over to the chat and we can, discuss that. Making sure everyone feels valued and heard. Yeah, making sure that people actually can be there as their full selves. Creating safe spaces. Yeah, making sure that your community, your council meetings are safe for people to be themselves, to talk about their experiences and how their particular aspects of or their characteristics are supported there, that people can show up as their full selves. They're not scared to share their pronouns or to talk about their partner or their spouse, their husband, their wife. Okay, everyone feels that they have a voice and are not afraid to join in. Yes, that they can speak, that they're not, and it's not, there's no fear. Active listening and cultural safety. Absolutely. And so we're going to talk about a few things that your council can do to really ensure that, as another person's pointing out, everyone has what they need individually to thrive, and that as a community, it's safe and welcoming. Wonderful. Thanks for the discussion. Diversity refers to the wide range of characteristics that make each person unique. It includes, but it's not limited to, ethnicity, race, gender identity, sexual orientation, their age, physical abilities and disabilities, your education and lived experience, religion and spirituality, your cultural background, beliefs and values. So that is the characteristics of what make us unique. And understanding and respecting those differences amongst family members, amongst your council members, is really important to promote that welcoming and supportive environment so that long-term care communities are places where everyone thrives, where residents, families, and staff can live their best lives and be their whole selves. Because inclusion is ensuring that all individuals, regardless of their abilities, disabilities, or healthcare needs, are respected as valuable members of the community. And so that's specific for a healthcare setting. And it's really important, as I'll talk about in a moment, to think about how people are able to show up in healthcare so that they get the right care. And to be inclusive, it's important to identify and take steps to remove those barriers to meaningful participation. An inclusive group is diverse. But a diverse group isn't always inclusive, because inclusion is active. It's active participation, intentional behaviors, and an intentional openness to difference. So inclusive groups are diverse, but diversity is the starting point to get you towards inclusion. This graphic is called the belonging tree, and it was developed with our Diversity, Inclusion, and Equitable Representation Advisory Committee, or DIRAC. And so this graphic is showing what does it take to grow a tree. We have the soil, we have the earth, the land. That's the foundation. So in order to get to belonging, we have to have dignity, inclusion, equity, respect, diversity, and representation. And the resources, the energy, just what goes into watering the tree, that's the energy that long-term care home staff, residents, caregivers, family councils, and sector partners put in. You're enabling the tree to grow. And when that tree can flourish, when we have true belonging, we see things like the adoption of person-centered language and practices, increased accountability for words, actions, and behaviors, that where we have the skill, the knowledge, and the confidence to say, that didn't land with me quite right. Can you explain what you were thinking there? Because I found that really hurtful, as an example. There's a recognition of that we all have multifaceted identities, needs, and experiences, and it's creating safe spaces for all residents, families, and staff. You'll see an opportunity for open dialogue, learning, and understanding. And with that, you'll be able to combat biases and various forms of discrimination. As humans, we all have biases. We do. They are our mental shortcuts or our heuristics that over time have allowed humans to evolve. But not all of them are useful. We may have learned, snakes are bad. You have bias about not liking reptiles as pets. Makes sense from an human evolution. But when we're extending those biases to groups of people, that's discriminatory. We want to see an intersectional lens for improving the quality of life and health outcomes for residents. And we prioritize cultural safety, competency, and sensitivity, and I'd add humility. I will never be able to know everything about another person or their culture or their experiences. But if I have the humility to know that and can be curious and sensitive towards that, hopefully I will be able to help also water that tree as well, so that we can elevate that and have a really healthy ecosystem in long-term care where everyone feels that they belong. Knowing that, we also know that there are gaps and there are particular needs of diverse caregivers and council members. But we wanted to, as FCO, as Family Councils Ontario, through our Interweave project, we wanted to explore what we don't know. So we know there are gaps, but what are they? So we wanted to better understand the caregiver and council experiences. We partnered with a great organization called Evenings and Weekends Consulting to better understand the needs and experiences of diverse caregivers and councils. There were some small house meetings, which are like focus groups, where people could share their experiences and perspectives. And we had a survey that was done to gather additional input from across the province. So I want to share with you what we learned. I'm going to start with the issues affecting long-term care residents and caregivers. Many residents, Black, Indigenous, racialized, QS, LGBTQ+ people have experienced systemic discrimination and oppression. It's occurred in schools, hospitals, medical clinics, and there's ongoing experiences of racism, colonialism, homophobia, and transphobia that can contribute to ongoing feelings of fear and mistrust. There are historical and ongoing impacts on care. There are two images on the left-hand side of your screen. The first one is of a man named Brian Sinclair, and it's a news clipping with the title, "Ignored to Death." Brian Sinclair's death caused by racism, Inquest Adequate group says. So about a man who had died in an emergency room after 34 hours of waiting without being seen, without being treated. He was labeled a certain way that was inaccurate, and he was seen as just an Indigenous person, and he was not given the care that he deserved as a human. The second one is titled "The Dark History of Canada's Food Guide: How Experiments on Indigenous Children Shaped Nutrition Policy." If you don't know about this is probably something that would be really good to look into, but how our current food guide is rooted in violence that was perpetrated against Indigenous children who were taken away from their homes and their communities and experimented on by the Canadian government. Now, these and other experiences of discrimination and oppression shape how some residents engage with healthcare systems and long-term care. There's racism, colonialism, homophobia, and transphobia. There's also research that's found that residents who identify as members of the QS LGBTQ+, is two-spirited, lesbian, gay, bisexual, transgender, queer questioning, how members of that community anticipate or have experienced discrimination in long-term care. There's concerns about being misgendered, about queer relationships being devalued or discredited, people feeling that they need to go back into the closet or hide or conceal this aspect of their identity to avoid stigma or mistreatment. Because they're afraid that long-term care policy and procedures will create a barrier to continued relationships with their chosen family. And so part of the reason that at Family Councils Ontario, we use a very broad definition of family is because chosen family is so important, particularly for some communities, such as queer communities, but also to recognize that we all have a particular take on family. Maybe chosen family is important to those who don't have a relationship with their family of origin, etc. There's also experiences that are shaped by broader social power structures like systemic racism and colonialism, a long history of violence against Black and Indigenous people in healthcare, plus segregation, residential schools. These experiences continue to impact Black and Indigenous communities. They face historical and ongoing harms. There's also been other unethical research, the Tuskegee syphilis study, where Black men were experimented on. So all of these feelings can affect long-term care and the feelings of safety and trust there. And Black, racialized, and 2S LGBTQ+ residents are at a greater risk of experiencing negative mental health within long-term care because of this, because of these historic and ongoing impacts. So things like residential schools, experiments on children, segregation, Jim Crow era policies in the US, the impacts of Black Canadians, this isn't old news. There continue to be stories, these things that have happened. And even if someone doesn't have a direct experience, their family, their community likely has. So this is impacting them still. So we really want to think as family councils with your goal to support high quality resident care and safety. We can't ignore these impacts because it impacts how people experience healthcare. We also heard other key issues around language barriers in accessing and navigating care. One of the most prominent issues reported by families and residents is that they cannot get services or supports in their primary language. This limits residents' ability to communicate effectively with staff and peers. It can be hard for residents to share information about pain or to participate in decision making, and it places them at an increased risk of loneliness and isolation. Being able to communicate in your language is essential to having family, community support, and good healthcare. There's also limited culturally responsive and inclusive care. Training for staff is minimal. Efforts are being made. The Ontario Centres for Learning, Research and Innovation in Long-Term Care, or CLRIs, do a lot around this. But we still have a Eurocentric approach to care and service delivery. Many residents live in an environment where their identity, traditions, and lived experiences aren't valued. There's limited access to translation and interpretation services, limited opportunities for culturally relevant food, and challenges to continue religious and ceremonial practices like smudging. There is work that's being done to address this. And so, as I said, I'm in the city of Hamilton, and just recently I saw that the city, for all of its facilities and locations and its 2 long-term care homes, has updated its smudging protocol and policy that emphasizes that Indigenous peoples have the right to practice religious and ceremonial practices, particularly smudging, and that there are ways to ensure that they can do so while also supporting the well-being of everyone else, and to overcome some of those barriers that people put up, like, oh well, if you're using an open flame to light sage, then that's going to set off the smoke detector, or we can't do that. You can do that. It just requires some planning and care. So there are examples out there of things that are going well. One great resource I always promote is Ndowe Benesi out of Thunder Bay with St. Joseph's Care Group. They do a lot of wonderful work to support learning about Indigenous protocols and practices, so that healthcare organizations can provide that really good, culturally responsive care. There's mental health challenges for caregivers and residents. The stress of being in long-term care can be really complicated or really heavy for folks, especially if they don't have others around them who look, speak, or act like them. There's structural constraints. There's a long wait list, limited number of beds, with chronic understaffing and workforce shortages. We do have a lot of long-term care home staff who are from equity-deserving communities and could provide really great care if they also feel supported. And members of marginalized or equity-deserving communities often delay application and entry to long-term care. And so they become underrepresented in long-term care because they're relying on informal community caregiving. Because, and I'll get to this in a sec, different cultural understandings of care. Families continue to provide unpaid support to loved ones even after they move into a long-term care community. They pick up the slack, and as they would say, in bathing, feeding, mobility, they may bring in food so that their person has their culturally familiar food. But race, class, and gender also play a role, and who takes on this role. It's also a differing view of advocacy and care and voice. Advocates are often family care partners in long-term care, but there can be a linguistic barrier that creates a challenge for them engaging in meaningful dialogue. Sometimes care partners of Indigenous, Black, or racialized residents are excluded, or their ideas aren't taken seriously, and they themselves may be mistrustful of the system or have reported experiences of discrimination from healthcare providers. So there's a lot that impacts people's experiences while they're in long-term care, but also many impacts from experiences that predate their move into the long-term care community. But it's not all doom and gloom, because there's good news. The strengths identified in the research are things councils can build on. Councils are open to new members and voices. Membership's open to anyone who's a family member or person of importance to a resident. You have a strong commitment to improving residents' quality of life. In order to ensure that you can build on this strength, it's important that you don't overlook when people from equity deserving groups or marginalized groups attend, and you don't attempt to brush off their efforts to contribute. For example, we had a council chair reach out to us with a concern that, in their opinion, a member was being disruptive in meetings. The member was the only Black member of the council present. So we talked to the chair, and based on what the chairperson said to us, we felt that the Black council member wanted their perspective to be heard and acknowledged as a unique perspective. The Black member was saying, I want my perspective as a Black woman to be heard and understood. So we advised the chair to talk to the member one-on-one to understand more of where they were coming from. Perhaps in the past, the healthcare system made them feel they weren't heard, or they really had to fight and advocate for appropriate care, because systemic racism affects the experiences and outcomes of racialized people in healthcare. There is lots of evidence there. And so we told the chair, ask the member what you need to feel heard. Unfortunately, the chair declined to see this as a priority for their council. But what I want to reinforce here is I know it can be hard to do this work because we're here because we care about long-term care and we think we're good people. But being a good person doesn't mean that you don't have biases and gaps or that you can't do more to support your peers and to support the home. But you have to be willing to be uncomfortable in the conversation and to be curious about how best you can help this person so that everyone feels that they belong at your council. So you can better support their goals and support everyone within the home. So how do you actually do this? How do you create inclusive councils? So we're going to share with you what we learned in the research so that you can add this to your action plan and take back to your council in your home. First, strengthen diversity and representation in councils. Really look at who your community is. What's the resident population like? Are we seeing the same communities and folks showing up at our council meetings? If, for example, this is a very diverse community, but only, I'm going to speak from, only from my perspective, if only white council members are showing up, to me, that's a gap. Because it means we're only speaking from a white approach. And we're missing so much else that can really help strengthen the representation in our group. Because we need those perspectives in order to share concerns and solutions. There are a lot of power dynamics that shape the comfort of people to participate in these group sessions. Could be the relationship between staff and families, past experiences, as we talked about, language barriers. But a lack of participation isn't because people don't see any issues. It's because the environment isn't supporting or encouraging their participation. So it's really important to think about how do you create culturally safe and inclusive spaces? How do you support respectful dialogue across differences, maybe navigating conflict or just those various perspectives? Improve accessibility, language, and participation options. Build relationships. And that is communicating with community organizations, maybe it's cultural organizations, faith-based groups, newcomers settlement agencies, Indigenous organizations, 2S LGBTQ plus groups, so that your council can better respond to their needs. Start looking at what's in your community. Is there perhaps a senior pride network? Is there an Indigenous friendship group that you can connect with to learn more? June is both Seniors Month and Indigenous History Month, so lots of things to celebrate this month. Has your council Acknowledge this at a meeting. Have you celebrated? Because that is one way to show that you care about experiences. It can inform your recruitment approaches, and then you can better understand support networks and who is family to residents, to your community, and make it and be explicit that these are the people that you want to join you. And so you also want to look at what are structural barriers that prevent participation. So you can look at meeting times, but also, do people need childcare? Is remote or virtual participation going to be helpful for folks? So, for example, if a council at a really diverse long-term care home wants to recruit more members, but the leadership team is from a dominant cultural group, remember to think about how could you reach out and recruit members from other cultures or backgrounds. Say it's a home that has a large white Canadian population, maybe also Chinese who speak Mandarin, Tamil, what have you, whatever your group is, and looking at who are we missing, and then you think about how can you reach out and recruit members from other cultures or other backgrounds. So that's one way that if you connect with community groups to better understand those experiences, maybe you'll come up with some ideas that you've never thought of, or some ways to reduce structural barriers. Because this is taking a systems-focused approach where it's not about individual people per se, it's how do we recognize the systemic issues that affect how and if people show up at our council meetings and how they participate. Also, we say, think about the accessibility of your meeting space. How do people actually participate? Advancing accessibility is about creating barrier-free communities, workplaces, and services for all Canadians. There are more than 6 million Canadians aged 15 and older who have a disability. That could be something perhaps more obvious around a physical disability, but there are a lot of invisible disabilities as well. So someone who may be deaf or hard of hearing, someone with autism, or autistic people, there are different aspects of our identity that can create barriers. So think about what could be a barrier to participation. For example, for in-person meetings, can everyone get into the room where you meet? Does it have a barrier-free entry? Are there stairs? Are there automatic doors? Can you control the lights? Turn them on or off, or dim them? What kind of lights are available? For some folks with a disability, harsh overhead lights can cause migraines, for an example. And that could be a barrier to someone attending a council meeting. Does your home have a policy around scent? Because for some folks, scents can be very triggering and can make them feel quite ill. If you have members who are deaf, can you get an ASL interpreter or use a TTY system? And describing the visuals for folks who have visual impairments. You say also keep your visuals simple, use simple text, plain language, jargon-free, explain what acronyms mean. For a virtual session, if you have an ASL interpreter, you could pin or spotlight them depending on the system. Think about, is your system compatible with assistive technology? And features should be easy to navigate and take time to explain how to use the platform. One really, simple thing that you could try is enabling closed captions, or informing people how they can enable closed captions on a virtual space. For some folks, having closed captions really does go a long way towards them being able to understand what is being communicated. Personally, I often use closed captions when I'm watching Netflix. My husband may not love it because he finds it distracting. So it can be examples of competing needs, but it is something that I find helpful, which looking at me, you might not know. but I feel really welcomed and supported when I attend something, and there's ample space not only to sit comfortably, but also to stand when I need to support my body and my health. So there are lots of things you can do that support accessibility. And think about, how do people communicate and participate meaningfully? So it can be really affirming if you acknowledge important cultural dates and observances in meetings, and avoid holding your meetings on those really important dates. Let's say you always meet on the third Thursday of the month, but you know that in September, there is going to be a conflict with a Jewish high holiday. You could move your meeting. Even though it's always the third Thursday of the month, you could move it so that folks from the Jewish community can attend. If there are people who are celebrating fasting and they're going to be breaking their fast, or who are fasting and are going to be breaking that during a meeting, making sure that they can bring and safely store what they need to, or that you can provide some food and beverage so that they can attend the meeting, but also take care of their practices around that religious observance. Include a land acknowledgement where appropriate so that you reflect on whose land you're on. But also don't make it just words. Also think about, how can you celebrate or share more about the local Indigenous communities? Could you have a guest speaker come in and talk about practices and protocols and celebrations that long-term care residents may want to participate in? Provide materials in multiple languages when possible. Use clear, consistent, and accessible communication. Think about your font choice, the font size. In your materials, can people easily zoom in? Are the visuals still clear when they do that? Think about different ways for members to share ideas and feedback. Some people are great at communicating in the moment, especially if the meeting's in English and English is their primary language. But maybe someone needs more time to think and reflect or communicate in a written method because it's more accessible for them. Maybe they need more time or things rephrased if English isn't their primary language. So also think about, all of this adds up to building strong, respectful relationships among members. If you acknowledge what matters to someone and you can be flexible about your meetings so that it's not a choice between a religious or cultural celebration and attending a family council meeting, if you can honor the land in which you're on and provide education and support and connection to local Indigenous communities, if you can recognize that you're in a home that has a large, maybe Chinese, Mandarin, or Cantonese population, and the materials are also available in, say, simplified Chinese, that could go a long way. And think about ways that members can give you feedback and set a space so that they will give you feedback. They will say, this isn't quite working, or we need to think about this. So what I want you to think about is, how does this connect to your council and your community, your long-term care community? A first place to start is, who is in our community? Do we have a very diverse long-term care population? So are those family members coming to council or not? There's a gap there if not. Can also be, what is your council already doing to support accessibility and inclusion? So we do want you to celebrate those successes as well. Big and small, what are things that you're doing that support belonging? And how are you currently supporting clear communication and meaningful participation in meetings? So these are a few things to really get started on. And as you go through the process of creating a more inclusive council so that people feel they belong, here's what we suggest. Continue this conversation with your council. Start asking questions. Say, hey, I learned this from Family Councils Ontario. What are some things that we can do to be more inclusive? Choose a date and time when you can revisit the discussion. Put it on your agenda. Share materials with folks in advance. Materials from the CLRIs, Ontario Centres for Learning, Research and Innovation, are a great place to start. Let's say you want to better understand the experiences of 2S LGBTQ plus elders and seniors, Senior Pride Network, Rainbow Health Ontario. There are resources out there that you can pull together and share with folks. Consider what you need to prepare to be confident facilitating that conversation. And it doesn't mean you're not going to be worried or, nervous or scared about it, but what can you do to improve your own confidence in having these conversations? And really think, we're here to improve the resident experience, resident quality of life. And to do that, we have a family council because we want to participate in that. You can also think, what are the experiences of the staff? So we make sure that they feel that they belong. And so thinking about, what are the outcomes you want? And then you can work backwards and be like, okay, I want to make sure that I focus on, helping people understand, making sure everyone has an opportunity to participate. If you map that out, you'll feel more confident facilitating the conversation. And of course, look for the resources and supports that can guide your next steps. We'll have a series of materials that you can share, that you can use and share with your group, and also reach out to us at a Family Council of Ontario for support. And now I'm going to make some time for a Q&A. So if there's anything that you want to ask regarding this topic, please do so in the Q&A box, so that way we can address some questions. Or if you have any comments or suggestions, please chime in. If anyone has an experience they want to share, let us know as well. We also really want to share what's working well from your council. How can people actually thrive and feel that they should be at the table with you, that they have a place, that they belong, that you're going to listen, and that together you'll be able to create really culturally safe and affirming spaces. Can you share recommendations for family councils who want to recruit individuals that are often represented due to cultural and linguistic differences? Start from a place of curiosity. Be like looking around the room and being like, oh, okay, we have mostly folks from this community or who speak this language. Ask your long-term care home, your administrator, if they can share information on the demographics within your home. So you can get a sense of, what are the gaps? Who is underrepresented here? And from that, then I'd say then you can make a plan. Like, okay, we want to recruit more, Black community members. We have a lot of folks who speak Chinese. So we want to make sure we get more folks who speak Chinese, so that Chinese members of the community, we hear their needs. So you set some goals, just like any other recruitment, set some goals, and then you do some research. Start to prepare yourself for what maybe some of those barriers and challenges are. So doing some research for better understanding. And then, hopefully there could be someone within your community, a family member who you could talk to and say, we've noticed at Family Council that we're not getting everyone represented on our council. Can you tell me a little bit more about what it would mean for you to be meaningfully included here? If you have those connections, you could do a survey. You could do maybe a version of a family interest survey, where you're asking folks if there are specific barriers that they're encountering in that. So maybe you get a barrier um, around someone, maybe folks who are deaf or hard of hearing, like saying, I can't actually understand what's being said during a family council meeting. Like, okay, well, is there a virtual option where we can ensure that people have closed captions? So I think you have to start with getting a baseline, really identifying what the gap is, doing research about those experiences so you can at least understand some of the barriers, enablers, and what's contributing. And then, are there folks that you can talk to within your community, those you have a relationship with, and can say, we want to do better and we're looking for you to help with that, and then coming up with some strategies. Because as was being said in the chat, what's a good way to bring that up when you've had a really good council, it's been think you've been really strong and effective, but now you're thinking, okay, we have this gap. How do you bring that up? So you could, as a group, watch this presentation together. You could ask people to anonymously write on a piece of paper, put in a fishbowl, and then people can take turns reading out the difficulties that people are experiencing. And I like that idea because you're providing an opportunity. You're not forcing people to, out themselves as having a particular need if they're not comfortable, but finding ways to get that feedback, because it may point out something that you're not even aware of, or you can put, having also some suggestions within that process, like things you may not have thought of. That can be really helpful. I'm not saying it's going to be, super easy, but it's someplace you can start. As Tiffany's pointing out, you can also look at, are there certain health conditions that are more prevalent in specific cultural or ethnic communities? Yes. For example, sickle cell disease is more commonly found in people of Afro-Caribbean descent. So in long-term care, it's important to recognize these differences so you can provide appropriate culturally responsive care. Tiffany says, I find it valuable to share my experiences to help others learn and build greater awareness. And absolutely. And that's why I start this presentation by talking a little bit about myself. Not to make it all about me, but hopefully to model that you can do that. Of course, I choose what I share and how, and that'll be different in different settings. But my hope is that, if I can share that I use she and they pronouns, maybe it'll inspire someone to communicate theirs. And even if you think it's obvious what pronouns are used, and as an example, being clear about that, actually saying these are my pronouns, hopefully can make other people feel that it's safe for them to do so as well. You also may not always know who's an Indigenous person. As much as I hate the term, there's, white passing, which I don't like, but I know some people might resonate with it. So you can't assume that someone is or isn't something, doesn't have a particular experience. But if you can create space for them to feel that it's safe to share that, and you'll build deeper relationships, and then you can better understand what are the needs of residents, caregivers, and staff, and how can you meaningfully advocate for better as a council. So you have to start with figuring out what you don't know so that you can actually figure out what you can know and what you can do to improve. So I'm going to give a couple more moments for folks to chime in, reflect on perhaps what resonated with you. We also will have a feedback survey. So if you have feedback about this presentation, please do share it, because we are continually improving what we offer, because I want councils to celebrate inclusion and to think about how when we have more voices, when we have more perspectives, we can more meaningfully support the resident, caregiver, and family experience, and support home staff as well, who they themselves are whole human beings with experiences of aspects of identity, of what's in their invisible backpack. And that absolutely affects how they show up as well. So the more we can do to support that, the better. Kathleen's pointing out it takes time and learning for people to be comfortable accepting a particular part of their identity. I walk with a cane and have since I was in grade 7. It wasn't until I was in my late 20s that I was comfortable to stop masking when I was in public. Yeah, so masking as in hiding a particular part of your identity. Sometimes sharing a resource can help that person experience a life-changing light bulb that allows them to accept a part of their identity and embrace it rather than hide it in groups. Absolutely. Thank you for sharing that. I would love councils to embrace all aspects of their members' personhood and their humanity, and not relying on bias and assumptions, but really creating a safe space where people can show up as their full selves, their full experiences, positive and negative, to create humane, affirming, and high quality long-term care homes. So at the end of the day, that's what we're here for. Otherwise, you would not be spending your time participating in this session, watching the recording, or otherwise exploring how you as a family council can connect through care to create belonging and community and to really create positive actions. So we're at time. I'm going to turn it back over to Tae Young, our event manager. If anyone has any other questions or requires more support, please connect with us and we'll be happy to support you along your family council journey, whether general questions or how you can specifically support belonging in action.